In this video, I will cover an important concept in the cardiovascular system called cardiac output. Cardiac output is the amount of blood flowing through the left ventricle in 1 minute. Cardiac output is equal to stroke volume times heart rate and is measured in liters per minute. The average cardiac output for an adult is about 5 liters per minute. This is about equal to the entire blood volume. So the heart will pump the entire blood volume in every minute. Heart rate is measured in beats per minute, and stroke volume is the amount of blood that can fit into the ventricle. Stroke volume is equal to the end diastolic volume minus the end systolic volume. The ventricle fills during diastole and empties during systole, but not all of the blood leaves the ventricle during systole. For example, the average end diastolic volume is about 120 milliliters. Remember, the ventricle fills during diastole. The heart then contracts systole and most of the blood exits. However, there is still about 50 milliliters left in the ventricle, so the end systolic volume is 50 milliliters. If we subtract the end systolic volume of 50 milliliters from the end diastolic volume of 120 milliliters, we have a stroke volume of 70 milliliters. Now we can calculate cardiac output by multiplying our stroke volume of 70 milliliters by the heart rate. Let's say the heart rate is 70 beats per minute. This would result in a cardiac output of 4,900 milliliters or 4.9 liters. This means that enough oxygenated blood is getting to the tissues. So, what affects cardiac output? Things that affect heart rate and stroke volume also affect cardiac output, and there are a number of factors affecting both. For example, heart rate can be affected by the autonomic nervous system, whereby the sympathetic division speeds up the heart rate and the parasympathetic division slows it down. Other things that affect heart rate are age and fitness levels. Stroke volume can also be affected by fitness levels. For example, fit people can have a larger stroke volume, which causes a slower heart rate, to balance out cardiac output. Preload, contractility, and afterload all affect stroke volume. Preload is the pressure on the ventricular walls after filling, which is at the end of diastole. Contractility is the strength of contraction during systole, and afterload is the force the heart must work against or overcome during systole. Starling's law states that the stroke volume will increase with an increase in preload. In other words, the more blood that enters the ventricle, the more forceful it contracts. I sincerely hope you've learned something about cardiac output. Thanks for watching, and see you next time.